If you've been searching for money-saving health insurance options, then today's video is for you because I have some vital information to share, which I only just learned about. So if you're self-employed, or if you are a 1099 contractor, or if you're just a healthy person who does not use the expensive insurance that you have, then you are going to want to listen to today's video. I learned about this cost saving alternative only over the past couple of months, and this is after working here for over 10 years. I never heard about this, and I felt hurt that I actually am only now learning about this, having wasted tens of thousands of dollars over the years paying for expensive health insurance that I barely use. My family and I barely used. So listen up to today's video. We're going to talk about the cons of the traditional health insurance. We're going to talk about what the alternative is that will save you tons of money. We're going to talk about examples of this alternative that you can check out. We're going to talk about some of the benefits of this alternative, and we're going to talk a little bit more about who it is for. So let's get into this video. Essentially, like I said, the health insurance as it is extremely expensive, and I'm too embarrassed to say how much I was paying for health insurance for myself and my husband and our son. And we are healthy people. We don't take any medicines. We only go to the doctor for little routine checkups, right? But we were spending thousands and thousands of dollars, and last year I was like, this is ridiculous. Like, there must be a better way. And so I started asking questions, particularly to some of my colleagues who are not employed by hospitals anymore. We work as contractors, so I'm a traveling doctor. And so I started talking to my colleagues and got one of them mentioned, well, a lot of them were saying just go, some of them get insurance from their spouses, some of them go on the government network to find insurance from the government plans. And then this one colleague of mine told me about this alternative, and I was like, oh my goodness, this is perfect for us, right? So unfortunately, traditional health insurance, it is extremely expensive, like I alluded to, right? You have limited choices with insurance, okay? You have to see a doctor who is in the network, so you can't just choose the one that you know and love. You can't go to visits more frequently than they say. Like, for example, my son, sometimes, we travel, right? So if I'm traveling, I might want to move up a dental appointment by 1 week. And I've called twice to do that for my son, and I was told, well, actually, no, you can't come earlier because the insurance will not pay, right? So even if it's just a couple days earlier, they will deny it, okay? And I was like, this is all very ridiculous, right? Sometimes they deny blood tests. They say, oh, that blood test is not covered and you have to pay for it. So if you want to look in detail to your metabolic health, you want to get something like a fasting insulin test, they say, oh, we're not covering that because you're not eligible, right? Which is totally ridiculous, okay? And so it's like, why am I paying for this health insurance if I don't want to get the things that I want to get? Not to mention too that a lot of doctors are getting sick and tired of this health insurance because of all the paperwork they have to fill out and sign, and it's just getting really cumbersome. So a lot of disadvantages to traditional health insurance. So enter the alternative. And what the alternative is, it is health sharing. So it's a health sharing plan. And with the health sharing plans, right, they specify that this is not health insurance, because if they call themselves health insurers, they would have to be bound by specific rules and regulations that health insurance companies are bound by. So these are not health insurance plans, it's cost saving. And what happens is that a pool of people come together and they put money into this pool, and when anybody in that group of people gets sick, then they take money from the pool that everybody put into to pay for the sick person. Now, of course, there is a copay, there's a deductible, I should say, right? So you can select, depending on your plan, up to how much you are willing to pay, up to how much you can afford per year, and then you have the copay, and then after a certain amount, the health sharing plan will cover the cost for you. Now, the good thing about the health sharing plans is that they actually cover you for catastrophic problems. So if you had a heart attack or you got diagnosed with cancer, something, a big ticket item like that, then you can rest assured that the plan will help you, okay? Overall, the costs, though, are lower. So if you do get sick, even if it's catastrophic, the beautiful thing of these plans is that they help you negotiate a good price. So I think a lot of you might know already that, if you don't know, well, here's some news for you. The cash price of anything you need in healthcare is always going to be lower than the insurance price. So the insurance companies are billed a higher price, and there are a bunch of different middlemen who take their cut off the top, and then we, the healthcare workers, the doctors, we get a small fraction. So you might be paying your bill and saying, well, oh my goodness, like that doctor is making tons of money from me. And I realized that once when I went for an ultrasound and the bill was $450, and when I looked at it, the doctor got $100 and something, and then there was a facility fee, and then there was the machine fee, and all these other fees, right? And the doctor just got a tiny fragment of the money. Okay, so the cash price, if I was paying the doctor directly, somebody who had a standalone practice, then I would pay a fraction of that $450, okay? And the cash price is often as little as 40% of the price that's quoted to the insurance. And these health sharing plans actually have people, they have a staff of people to manage the plan, okay? And they negotiate these good, much lower cash prices for you. So definitely more affordable. Now, what are some of the examples of these plans? Well, there are several. So when I was doing my research, and the good thing, the person who told me, the colleague doctor, she told me about 𝐸DERA, 𝐸DERA. That's the plan she told me about. And then we called it and we realized that it wasn't going to work for us. But fortunately, the person we spoke to was kind enough to give us some other options. And so we went and called some of the other options, and these people, they were all very friendly, because again, like I said, they actually gave options, even though it was potentially their competitors. But this is how I found out about all these examples of cost-sharing plans. The 𝐸DERA is one, Samaritan Ministries is another one, Christian Care Medishare is one, Catholic Health Share is another one, and then Solidarity Healthcare is one. And Solidarity is the one we ultimately ended up with. But they all have a variety of features, right? Some of them are bigger than others. You might think, okay, if it's a bigger plan, then that's more people in the pool, which and you might think that that's a little more stable than a smaller plan. But I think all of them were pretty good, and some of them actually, they don't cover people who are over 65 years and over. So that's another thing for you to consider, depending on the age limit, because they said that essentially if you're 65 and over, you are eligible for Medicare, so we don't have to take you on. And then of course you might be a little more sick, and so might cost the health share group a little more money, right? But those are some of the examples. Now, in terms of the actual benefits of engage or signing up for one of these health share plans, the big benefit I see is just freedom. Well, the biggest benefit is the cost. Now, like I said, our insurance plan was thousands of dollars. It's just too embarrassing. But now with this health share, we are paying 27%. The premium, the monthly premium for us 3 people is 27% of what we were paying before. And let's just say, so you'll get an idea of how expensive our insurance was, but essentially we are paying less than $800 a month for us as a family. And we actually chose, because of how the costs worked out, we chose the one with a lower deductible, and still we're paying less than $800. And that might be because we don't take any prescription medications, we don't have any chronic illnesses, so maybe that's the case. It will vary depending on those features of your particular situation, right? So the cost, right, affordability is the biggest thing. The second benefit that I see is just the freedom to choose when you're going to go to the doctor. You go whenever you feel like going. The freedom to choose who you're going to see. You see whoever you want to see, right? Some of the health sharing plans actually have some network providers, but they don't specify that you must see those people, okay? You also choose where you're going to see them, whichever state you want to see a doctor in, you see a doctor in whichever state. You don't have to worry about networks. And then you don't have to worry about forms and different forms to fill, etc., etc. With these health sharing plans, some of them have cards. So with Solidarity, we actually have a card, right, that, with numbers and so on, so that we can reach out to them if we need them to discuss, to help us negotiate a cash price, right? But all in all, you don't have this bunch of forms, and in the end, doctors are relieved because they don't have to fill forms, okay? Part of the cost in healthcare is having to hire people to do all this extra paperwork for you, right? So those are the benefits of this plan that I see, right? And then we spoke about the cost, and also the fact that even if you do have an event, it's going to be maybe 40% cheaper. And another thing I have to say is that sometimes, and I've said this before, that having health insurance or not having health insurance sometimes is a blessing in disguise. Because when you have health insurance, then it seems to me that you get more done, and specifically more unnecessary things. And the more intervention you have done, the more you increase the likelihood of complications and even greater expense going forward. We see that every day in healthcare. So when you don't have health insurance in the traditional sense, the doctors are not going to want to do extra things on you because they're not going to get paid, right? So that is an advantage that I see as well. Okay, who are these cost sharing plans, health plans, not for? Well, if you have serious pre-existing conditions, medical conditions, this is not going to be for you, okay, because you're going to have very high costs. If you're taking multiple prescriptions of medicines that are quite expensive, this would not work out for you. If you don't want to help to pay for your healthcare, then share the cost of your healthcare. It's not for you. I know some people don't want to pay anything, even a copay. So if you don't want to help pay anything for your healthcare, this is not going to be for you. If you have great health insurance already that's quite affordable, then lucky you, you can keep your great insurance. You wouldn't really benefit from this. And another thing I'll say is that if you're an atheist, a lot of these cost sharing plans, they are Christian based. Okay, so if you are against Christianity, then these plans will not align with your beliefs, okay? But all in all, I think that these health sharing plans are a game changer. I think I didn't know about this. So if I didn't know about it, I'm going to assume that many of you do not know about this. And I'm going to assume, since I was so happy and relieved to find this option that was affordable, that many of you would be relieved to know that this is an option. It's a little scary sometimes when you think, oh my goodness, no health insurance. But in the United States, it was for several years that you got penalized if you didn't have health insurance. You were fined, which I think was a crime. But now, over the past couple of years, apparently they have removed that penalty. So you don't have to have health insurance, and these cost-saving plans will be just fine if you essentially fall into any of the groups that I discussed. So yeah, definitely look into it, and let me know in the comments below, did you know that this existed, that you could have these health sharing plans and save costs? Because maybe I'm clueless, but if you knew about this, let me know, or just share your thoughts in general with me in the comments below. Thanks for watching, and share this video with somebody who will benefit from this vital cost saving information. See you in the next video. Bye.